CNA Practice Test 2025 Infection Control New 40 Questions and Answers. Question 1. Where is the radial pulse located? Neck. Ankle. Thumb side of wrist. Inner elbow. Radial is at the wrist. Question 2. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier. Question 3. The normal adult pulse rate is 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 50 to 90 bpm. 60 to 100 bpm is the normal range. Question 4. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 5. Postmortem care is for: before surgery, after death, after birth, during sleep. Care given to a body after death. Question 6. Standard precautions should be used for: only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 7. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 8. What is the best way to prevent the spread of infection? Wearing gloves. Wearing a mask. Hand washing. Using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 9. Which of these is a sign of skin breakdown? Redness that doesn't go away. Tan skin. Dry skin. Freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 10. How often should a resident be repositioned? Every 4 hours. Once a shift. Every 2 hours. Once a day. Standard is every 2 hours to prevent pressure sores. Question 11. What is the first step when discovering a fire? Rescue residents. Activate alarm. Contain fire. Extinguish. Race protocol starts with rescue. Question 12. Which position is best for a resident having trouble breathing? Prone. Supine. Fowlers. Sims. Fowlers, upright, aids lung expansion. Question 13. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 14. When a resident is on NPO status, they can have water only, ice chips only, Nothing by mouth. Clear liquids. NPO means nothing by mouth. Question 15. What is a living will? A bank account. Legal document about end-of-life care. A birth certificate. A list of belongings. Advance directive for medical wishes. Question 16. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 17. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 18. A resident refuses a bath. You should force them. Respect their refusal and report it. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 19. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 20. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances.